Hi guys, I had another question. Someone asked me, I'm doing keto, but I have no ketones in my urine. So when I test myself, it shows negative for ketones, okay? So they wondered why that is. Let's talk about that. Number one, it could be that you're burning up all your ketones. See, the body is switching from glucose to ketones as fuel. So if you're burning all them up, it's not going to show up in the urine. And that usually happens after you've adapted to keto, a ketogenic diet, and also that you have done it probably more than 2 months. But if you've done it like under a month's period of time and it's not showing up, this is probably not the case because it takes a while for you to become very efficient and burn up all those ketones. Okay, number two, are you doing intermittent fasting? If you're not, you need to. I'll put some videos down below, but every time you eat, you spike insulin. So the combination of keto and intermittent fasting is the best combination. You need to do that, bite the bullet. But this, because if you're eating 6 meals a day with keto and all this fat, it's not going to work. So you need to throw this in there. It's not reducing the amount that you eat, it's reducing the frequency that you eat. Number three, this is interesting because I'll ask people, I'll say, are you getting enough sleep? And they're saying yes. Are you tired? No. And so I'm pulling a string. I said, how many hours of sleep do you get? They go 6.5. I said, well, what do you do during the day? I work all day long. I push myself. I said, what would happen if you were just to sit there and just not do any work? I would fall asleep. Okay, good. Well, chances are you're not getting enough sleep. In other words, a lot of people don't realize that their body is tired. They're just pushing through it, not putting any attention on it, but they're actually tired because they're not getting enough sleep. Okay? So, what I recommend, and I've done this several times, go to bed earlier. Squeeze out another hour, hour and a half of sleep. Stop watching the news, especially the news, and try to take a nap. But you need about 7.5 to 8 hours to really maximize not just fat burning and improve your ketosis and your metabolism, but also just to improve your recovery after your workouts. You'll see more change. That little change will make a huge difference. I take the sleep aid before bed. Maybe you want to take 2 of them before bed, and then you add the calcium lactate with that. The combination of calcium lactate and sleep aid work really good. Calcium lactate just gives that little extra push to get into sleep faster. And then not too much protein. Some people are consuming way too much. We want 3 to 6 ounces, and we want to make sure you're not snacking with protein. Protein will act as a stimulant and prevent you from sleeping. And number 4, exercise in the fasting period. In the other videos, I told you to exercise in the eating window, okay, or right before you're eating and right after you're eating. What I'm suggesting, if you don't have a blood sugar issue, and you should just try this to see if you can do it, work out in the fasting period. So let's say you ate at 12 noon and you had your dinner at 5 or 6, you would fast in the early morning. Or if you eat a breakfast and your last meal is at, let's say, 2, and you worked out at 6 or 7, I kind of like to do that. I think you're going to see a lot more change because you're going to enhance the growth hormone factor when you work out and see more change in the ketones in your urine. Okay, go ahead and try these and put in your comments below the changes that occur. Hi guys, hey listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now and we'll send you a report.